The day before, the White House announced that the President of the United States, Donald Trump, has a vein disease called chronic venous insufficiency. During another press briefing, White House Press Secretary Karoline Leavitt reported that 79-year-old Donald Trump noticed swelling in his legs, which led him to see a doctor who then made the diagnosis. But now, Donald Trump's detractors in the United States have already started even joking about why Donald Trump has such a strange skin color and why he is often seen wearing makeup. Recently, Trump was photographed with makeup stains even on the back of his hand. And now the White House has stated that this is not related to any illness. This has nothing to do with the condition of the President of the United States' veins, but rather represents bruises that resulted from frequent handshakes. They say that world leaders come and shake the American president's hand so firmly that he developed a bruise on the back of his hand. That's why it had to be covered up with makeup somehow. Let's discuss in this episode what is known about Donald Trump's vein disease and how serious it actually is. My name is Alexei Peachy. Today is July 19th, according to the calendar. Let's go through everything step by step, but before we start, I ask you to subscribe to this channel, give it a like, leave any comment, and be sure to subscribe to my Telegram channel, Peachy News. The link to it is in the description of this video. So I'll start right away with a quote from White House Press Secretary Karoline Leavitt, who announced that Donald Trump was diagnosed with a vein disease.
I want to note that many people have speculated about the bruises on the president's hands, as well as the swelling in his legs. In the interest of transparency, the president asked me to read you a note from his attending physician today. In recent weeks, the president has noticed slight swelling in his lower limbs. As part of routine monitoring and out of caution, this symptom was thoroughly examined by the White House medical unit. The president underwent a comprehensive medical examination. A Doppler ultrasound of the veins in both lower extremities was performed, which revealed chronic venous insufficiency, a benign and common condition, especially among people over 70 years old. No signs of thrombosis, deep vein or arterial disease were found. Laboratory tests included a complete blood count, an extended metabolic profile, a coagulation panel, a D-dimer test, a natriuretic peptide level, and a cardiac marker. All the results obtained were within normal limits. Echocardiography also showed normal heart structure and function. No signs of heart failure, kidney dysfunction, or systemic diseases were detected. In addition, recent photographs of the president showed slight bruising on the back of his hand. This is consistent with mild soft tissue irritation due to frequent handshakes. And taking aspirin as part of cardiovascular disease prevention. This is a known side effect of aspirin therapy. The president is in excellent physical shape, which I believe you observe personally every day. That is exactly why he wanted me to share this information. We will provide a written statement from the president's attending physician.
According to a note from White House physician Captain Sean Barbabella, which was given to reporters, Trump's condition is benign and common, especially among people over 70 years old. And all further symptoms and information come directly from this note and the conclusions of American doctors. Chronic venous insufficiency occurs when the veins in the legs do not allow blood to flow back to the heart, causing blood to pool in the lower extremities. Normal blood flow from the legs to the heart happens against gravity, which can become a difficult process for elderly people. This may be due to weakened vein valves, which can really happen with age. What are the symptoms? When blood pools in the legs due to chronic venous insufficiency, it can cause swelling like that seen on Donald Trump's ankles in recent photos. The condition can also be accompanied by pain and itching, and in more serious cases it may present with skin changes, ulcers, bleeding, or deep vein thrombosis. That refers to the development of blood clots in the legs. It can be associated with serious diseases, but by itself it is not a serious condition, and it is very common. This is a statement by Dr. Matthew Edwards, the head of the Department of Vascular Surgery at Wake Forest University. I would say that among people his age, this condition occurs in 10 to 35% of people, he says. And so, according to experts, other risks include being overweight, a history of thrombosis, and jobs that require patients to be on their feet for long periods of time. What does Donald Trump's personal physician have to say about this? After President Trump noticed swelling in his legs, the White House medical unit examined him as a special precaution. This is stated in a statement by Trump's attending physician, Sean Barbabella. Dr. Barbabella wrote that President Trump underwent a comprehensive examination which revealed chronic venous insufficiency, which he said is a benign and common condition. Next, I will provide a quote. It is important to note that no signs of deep vein thrombosis or arterial disease were found. Trump remains in excellent health. Dr. Barbabella further reported that the tests also showed normal heart structure and function. Quote, no signs of heart failure, kidney failure, or systemic disease were found. Barbabella also noted that the bruises on the back of Trump's hand, which were visible in recent photographs and sometimes concealed with makeup, are not a disease. Next, again, her quote. This is consistent with minor soft tissue irritation due to frequent handshakes and the use of aspirin, which is taken as part of the standard regimen for cardiovascular disease prevention. Other medical experts who have spoken to American journalists say that, in principle, such a possibility is indeed plausible, despite how wild it may sound. How could this condition affect President Trump? The American Society for Vascular Surgery stated that this condition can cause heaviness in the affected limb, as well as swelling and pain. In some cases, chronic venous insufficiency can also cause painful spasms, cramps, and ulcers on the legs. According to Professor Cheddar, it can also lead to reduced mobility and physical activity. Wearing custom-made medical compression stockings can help manage this condition, and experts also recommend that patients keep their legs elevated at night and use lotion. And Professor Cheddar said that this condition very, very rarely poses a threat to life. Interestingly, Donald Trump himself literally underwent his first annual medical examination of his second presidential term just this April. And then Dr. Barbabella wrote the following in a memo. President Trump remains in excellent health, demonstrating good function of the heart, lungs, nervous system, and overall physical abilities. During the health assessment, it was found that the president takes several medications to control cholesterol levels, as well as aspirin for the prevention of cardiovascular diseases and a cream to treat a skin condition. The President of the United States regularly, I remind you, boasted about his good health and once called himself the healthiest United States president who ever lived. And here, by the way, I'd like to remind you how Donald Trump often mocked Joe Biden's health, implying that he was old, sick, and definitely couldn't be the next president of the United States. And after his first annual medical checkup, Trump told reporters that overall, quote, I feel like I'm in very good shape. In my opinion, I have a good heart, a good soul, a very, very good soul. I don't want to speculate on this topic. I would put a full stop here and wouldn't blow this out of proportion any further. Yes, indeed, the President of the United States, Donald Trump, does have a certain illness. It was officially announced at the White House. They didn't try to hide it. The only thing that personally confuses me is the argument that the spot on his hand is just a bruise from handshakes, which seems rather strange. But medical specialists say that in principle, it's possible, it's acceptable, that at his age, a bruise could really appear from firm handshakes. I'll put a full stop on this, not even an ellipsis. So, friends, share your opinions, your thoughts, your conclusions in the comments under this episode. Subscribe to the channel, hit the bell, and don't forget to like. That's all for now. Take care. Goodbye, everyone.